So Stacey, this is so exciting to have you.
Oh, thank you.
Thanks for doing this.
I really appreciate being here.
It really is an honor, and it's so exciting. I guess I want to say welcome back to Utah. Welcome
Thank you.
back to Salt Lake City. I know you're already having quite an impact here, and it's been thrilling to have this relationship where we've been trying to work close to make sure that we do the most in Utah for LGBTQ individuals.
You know, being that closet trans girl that grew up in Beaver, Utah, that is where I want to get. You know, there weren't the Encircles when I was growing up, and it's so essential to help save lives here in the Mountain West.
Okay, so you mentioned Beaver. Does that mean we can we talk about you for a minute? Can you tell us your history? I know you've had an amazing career, and I think it would be fun for people to really know you well.
Sure.
Okay,
Sure.
so you start. Let's go back to Beaver, Utah.
Okay. What would you like to know about Beaver, Utah?
I don't know what it was like growing up there, and just whatever you'd like to share, what you think.
Sounds good. So I grew up on a dairy farm and cattle ranch in southern Utah. My family was deeply LDS. In fact, I was originally named after my dad's brother, who died in a farming accident trying to save my grandfather's life. But that grandfather was one of the town bishops. So deeply rooted in the LDS faith and whatnot. And, I came along 2 years later into this very entrenched conservative Mormon family. But grew up just being different and knowing that it didn't quite click. And so, I think one of my earliest memories of the possibility of transitioning and whatnot was coming home with my dad from the farm one day to have lunch. And my mom was watching one of the talk shows and whatnot, and they had trans women on it. And I think I was probably 8 or 9 years old. I'd always felt this way or whatnot. And my parents got into this debate as to whether God would allow these trans women to stay women and whatnot. And my mom jokingly turned to me and says, "Well, you want to be a woman, don't you?" And I, instead of answering it directly, laughed it off and said, "Oh, Mom, stop." But it was there, that
Really,
early age, yeah. And there were other dynamics, from an early age, I just didn't quite conform to gendered expectations. My mom, because of the financial reversal of the farm, had gone back to graduate school when I was in the first grade. And I was getting harassed a lot in school, just starting from the first grade on. And then by the 6th and 7th, 8th grade, it was getting so bad that usually by the final term of each year, my parents were pulling me out to homeschool me. And so my mom really knew that something was different. I needed to survive. So we've mapped out a plan that allowed me to graduate from high school at age 16.
Wow.
And so that wasn't necessarily for smarts. It was out of survival. It was getting the high school credits in order so I could go on to college at Utah State. I went to a year there, did internships in DC for a year, and September 11th happened.
Okay, we got to go back a minute, though.
Sorry.
Okay, so I want more details. So it sounds like you had amazing parents.
Yeah, I think my dad has really struggled in many ways, but the arc of where he's at today compared to then is much different. But my mom really helped me survive.
Yeah, because if she so early was asking you the right questions.
She will deny to this day that she had any inkling, and yet when we look at family videos, they're like, "Oh, how did we miss it?"
Yeah, okay. So, you leave at 16.
Yeah.
And you go and live in the dorms at Utah State.
Yeah.
And what do you study?
Law and constitutional studies.
Wow.
I wanted to be a lawyer. I wanted to work on civil rights, social justice issues. It's always been a passion of mine.
Okay.
When I was growing up in high school, I was doing service projects for a little elementary school in Ogden, Utah, raising money for, it was the school with the most poverty in the state, most homelessness and whatnot. So we were raising money for its sunshine closet for clothing and whatnot for the school, where kids were coming to school wrapped in saran wrap. So that
Seriously?
just to keep warm. Yeah. So
Wow.
From an early age, I've really been committed to social justice endeavors.
Wow. So you graduate from Utah State. You were young. You must have been
20.
20. Wow. And then?
I moved to Washington, D.C. and worked for Ted Kennedy on his Judiciary Committee and Health Committee staff.
Wow.
Yeah.
So how long were you there?
It was over a couple of years. Yeah.
That's cool.
Yeah.
Okay, so where did you go after that? I don't want to interrupt.
No problem.
I just want lots of details.
After that, so one of the challenges is, Senator Kennedy was phenomenal. He had a very queer staff, and many of them from Utah. I was the first intern and then staff member from Utah. And after that, he always took at least one intern from Utah State University every term. And most of them became staff members. And so it was a very queer, inclusive environment in certain regards, but there were some interactions. When I first arrived, there was a letter sitting on the desk I was assigned from PFLAG saying that PFLAG would not support any legislation that didn't include gender identity and expression. I took that letter to the attorney on staff that was handling LGBT issues, and I just seemed to know a little too much about that issue. So he invited me to start attending the various meetings around legislation of that nature and whatnot. And HRC put forward a non-discrimination policy they wanted senators and representatives to sign on to for their own staff. So I was initially in many of those meetings, and I know that the senator had no issue with it, but the office administrator that was kind of over the junior staffers didn't want those type of people in the front office. Wow. And so when I was hearing that narrative, I knew it likely wasn't a safe place for me to transition, despite knowing that Ted Kennedy was very progressive on LGBT issues, that I knew my direct supervisor would not be a healthy person to transition with. So I started to look for positions off the Hill and try to figure out what would be the healthiest place where I would likely be able to continue on my career while also being affirmed and supported, and I felt like academia was that. So I started looking for jobs at law schools and found one at American University, which was the 6th university in the country back in the late 90s to add gender identity protections.
You said the 6th?
The 6th.
Okay, so, that's a great school. Let me ask you, what is the year, just so we're kind of following?
So that would have been...
Or about?
I think 2004 or 2005.
Okay.
Yep.
Wow. Yeah, because I'm thinking it's surprising that in an office like Kennedy's, you wouldn't have felt safe. And maybe that's just those particular people that were there. But also, you think back, 2000... I want to say 1 or 3, the Supreme Court upheld a law in Texas that made it illegal for 2 men to live together, right?
That's actually when they reversed it. So that was
the
reverse? Yeah, Lawrence v. Texas in 2003. That I was working there that summer, and I actually got to meet. So the law clerk that helped write that brief became a law professor at the University of Utah, and she was clerking for Stevens. John Paul Stevens, and gave us a tour of behind the scenes in the actual justices' chambers.
Wow. So then so I've got it wrong. I've always thought the opposite, but that's the first time they turned it and said, Texas cannot do that.
Yep.
Okay, because the progress, it feels like since that case and what the LGBTQ community has done is awesome. Things have not moved enough, but there's been...
the momentum has been building since then, right?
Right. So you were right there.
That was happening. Massachusetts Supreme Court ruled on marriage equality, and it all started to snowball around that, which also met with a lot of the resistance with Prop 8 and whatnot. And so that's the challenge. Like, the more traction we get, also it's met with equitable resistance, right?
Right.
So
okay. So go back to American University. What was it like there, and what was your experience there?
In many regards, really phenomenal. I had really phenomenal bosses that had my back when I did finally feel safe enough to come out. I wanted to get a couple years of experience under my belt and some good reviews and whatnot, just as a safeguard. Like, if I transition and they suddenly, I'm getting bad reviews after I transition and I was getting good reviews before, then that's a good indicator that there's discrimination going on. But when I came out, I had my mom and youngest sister fly out to come out to them because my doctor at the time was refusing to put me on hormones until I was out to my family. So they flew out for that. And also, being a trans woman that was, transitioning at 24, 25 years old and 6'2", I wanted the most effect for the hormone therapy and whatnot. So I ran around the system. I pursued a black market orchiectomy and had my mom literally about 4 weeks after coming out fly out to Philadelphia, and I had this black market orchiectomy that was rather dangerous. It was in an illegal late-term abortion clinic. I sustained infections from that and hematomas, and that's when my bosses came to me and said, Stacey, what's going on? We can tell something's up. How can we support you and whatnot? And that's when I came out to them, explained what had happened, that because our health insurance excluded trans care, I had pursued this $2,000 cash option that was not a safe option. And my bosses at the time said, that's just not right. We are American University that claims to be a social justice organization, claims not to discriminate on the basis of gender identity and expression. Why is our health care excluding trans care? And so they went to the dean of the law school, and he was in agreement. And he went to the president of the university, and within 3 months, we had the backing of the administration to change the healthcare policies at American University, and it became the first private university in the country to offer transgender healthcare benefits.
Wow, that gives me the chills. That's cool. I mean, that's the power of what one person can do.
Yeah.
And
allies, too.
Yeah, and allies together.
Right.
And I'm sorry, though, that you had to go through it the way you did. I can't imagine the courage it took.
Well, thank you.
I mean,
and I think it shows both the systemic marginalization and also the power of privilege. I had an education, I had the knowledge of how to navigate law and policy, and particularly I was actually working on healthcare policy issues at the time at the intersection of intellectual property, so knew how to advocate for myself. And use that experience to also advocate and help change policies. I became the healthcare policy fellow at the Transgender Law Center in San Francisco, where we started to.
Is this after American?
Yes.
You left?
Well, I was in graduate school at Smith, so.
Okay, yeah, we got to hear these details.
Sorry. Well, I was an American, so I transitioned, and in many regards, really supportive environment. But I'd been there for a number of years, and I applied for a promotion. Received an email on literally Christmas Eve offering me the promotion as the unanimous choice of the committee. Returned to work just after the holidays and received an email rescinding it, and everything kind of went silent. Well, the position was a very public position as director of continuing legal education and had a lot of alumni relations. And I was told basically that I needed my health insurance because I was planning to have surgery in 6 months and not to rock the boat. And so I knew on paper this school looked really phenomenal. They had supported me through my transition. They'd had trans health benefits and whatnot, but I was trying to go for a more public role, and they clearly didn't want it. So I knew that I'd hit kind of a trans glass ceiling. And so after that, I decided it was time to make a change and go to graduate school, and I'd done all this policy work, but I could see that also a lot of policy wasn't lining up with the clinical side of things, and that also most folks on the clinical side of things were cisgender and not getting trans care and things like that. So that's when I decided to pursue my MSW. I'd already earned a graduate certificate in women, gender, and sexuality studies while I was working at American University.
So you got that from American?
Yep.
Wow.
While I was working there, and applied to Smith College, a couple other schools, but decided to go to Smith College School for Social Work because of its clinical focus. Really phenomenal education there as far as clinical work and whatnot, and its anti-racism mission. Really incorporates anti-racist pedagogy that I really appreciate. So anyway, I was at Smith when I became via telecommuting, the healthcare policy fellow with the Transgender Law Center, using my experience getting the health benefits at American University. We use that to advance parity, basically. So California already had a law in the books that was the Gender Insurance Non-Discrimination Act. And it had been on the books since 2007, and no regulations had been issued on it to really provide guidance to insurance companies around discrimination. So the Transgender Law Center, we went into the various regulators and said, we really need 3 regulations on the book. One, that people can't be denied insurance. One, that they can't have their premiums increased for being trans. And 3, that it requires parity. So it doesn't explicitly require trans care. But what it does is it says if you provide any type of care for cisgender individuals, you've got to provide it for trans individuals. So if you provide hormones to cisgender women, you've got to provide them to transgender women. If you do breast augmentation for somebody post mastectomy for breast cancer, got to do it for trans women. So it's a way of using non-discrimination laws to ensure that we are advancing the issue of or the access to care for trans people when we are often carved out explicitly and targeted to not cover our care.
Right.
So that worked in California, and then several other states, I believe about 15, 16 thereabouts, have issued similar regulatory bulletins using that and pointing to other federal laws like the Mental Health Parity Act and the ACA and things like that. And then the Obama administration comes in with Section 1557 of the ACA and issues similar regulations that under the discrimination provision, with sex discrimination, you're required to provide the health insurance companies that are regulated and their plans that are regulated by the ACA require parity of coverage for transgender individuals. So that's how we're trying to advance this. The challenge is that the way insurance plans are regulated is a mess.
Right.
Because small and individual plans are regulated by the state and the ACA, but large group and self-insured plans are regulated by a separate federal law from the 80s that is archaic. And here in the state of Utah, the vast majority of our health insurance is covered by ERISA. It's self-insured, and that allows employers basically to determine what they want to cover. The flip side of that is the work that, for instance, the Human Rights Campaign does with its Corporate Equality Index that pushes these companies to actually adjust their own policy, but they have much more freedom to adjust what they cover and whatnot. So you see companies like Starbucks covering trans care, including facial feminization surgery.
So the way things are currently, though, it allows for individuals who fall under the wrong insurance plans to still be discriminated against.
Yes.
And do you have hope that in the near future that will be resolved?
I hope so. I have hope that does. The challenge is that, when you're changing regulatory bulletins, if a new administration comes in that doesn't like that, they can go through a rulemaking process that changes that, which we saw. So Obama created this rule, Trump came in and disbanded it. Now Biden's putting it back in place. And so there's this constant back and forth, which also leaves things kind of a gray area that some companies continue to operate in, right?
Right. Okay. So you were working on this, give me dates again, or general time period.
So that would have been, 2011 to 2013, give or take.
Okay, so you finished your degree there.
Uh-huh.
And then did you practice or?
Yeah, I returned. So Smith's MSW program is structured so that you do all the clinical coursework during summers and then full-time clinical practicums during the traditional academic year.
Okay.
So my first year I did it at what was supposed to be an LGBT inpatient unit in Vermont that had overnight become the forensic unit for the state because Hurricane Irene destroyed the hospital. But then I got to help open the new LGBT unit while I was there towards the end of my internship.
Wow.
And then I moved back to Baltimore and did my second internship at Shepherd Pratt Hospital in Baltimore with adolescents in residential treatment. And then I got a job at Chase Brexton Healthcare in Baltimore, which is a federally qualified health center that got its start in the LGBT community as the gay men's volunteer clinic. So back in 1978, they started out volunteer clinic. Literally, the doctors and nurses volunteering at this clinic were getting fired by the hospital systems locally for providing care to the gay men of Baltimore. And its history tracks basically with the HIV and AIDS epidemic.
Wow, yeah, Baltimore's got quite a history. You probably worked with a lot of minorities, too, in that area that really needed the services.
Exactly. So Chase Brexton is what's known as a federally qualified health center. So they are charged under that structure with providing care regardless of ability to pay. it comes with other additional financial incentives from the federal government to do so. And basically, they grew. When I left there were close to 500 staff members. That this little tiny gay men's clinic in 40 years had become a healthcare organization that was bringing in $100 million in revenue, largely federal funding, to serve the community. And we started we had expanded to other marginalized community, BIPOC population, whatnot. But to ensure that we were staying true to our roots, I was hired to really build out LGBT programming, clinical programming, through their Center for LGBT Health Equity.
Okay.
And so we had behavioral health services, mental health services integrated into this clinic, along with primary medical care, endocrinology for gender-affirming care with kids, including what we call our Gender Joy program, which stands for Gender Journeys of Youth. And so we, Elise Pine was this absolutely phenomenal pediatric endocrinologist that really was phenomenal with working with parents that were having difficulty with coming to accept their kids and also understand how puberty blockers would buy them more time and really be able to process through a potential gender transition for their child. So anyway, helped build out that programming at Chase Brexton, and so I was there for a total of 7 years. And at the same time, I was starting a small private practice, and just as the pandemic was hitting, I had facial feminization surgery scheduled because we had through our union at Chase Brexton had negotiated to expand that coverage within our healthcare policy, and decided that I was really going to take a different route and try to do private practice to serve various communities in other ways. Yet the pandemic really taught me that I also wanted to be closer at home, because just before the pandemic, my sister had a baby at 26 weeks gestation. The baby was in the hospital for 107 days at McKinney. I didn't get to meet that baby until it was over 14 months old because of the pandemic, and I really wanted to be closer to family, and felt that this seemed like the right time to come back and also put my skills to use here. I was like, the time may be right for me to return to Utah to help move these things forward, despite a lot of the challenges out there, and some aspects of the community not understanding trans issues. Maybe I need to return to help with that.
Stacey, I feel like there's so much to say after that. First of all, thank you for being so candid and open about who you are. I mean, I think living an authentic life is something that most of us struggle with, right? Like, I never feel like I'm good enough to just say who I am. And I mean, to have you sit here and just tell your story is so beautiful and meaningful, and an example that we should all follow, right? Because that's where we bring people together. And
I think there's power in vulnerability, and I really have appreciated the relationship that we've built, that I can trust you with that vulnerability. And I am hoping that those that are listening in can understand that and appreciate that as well.
Yeah, and I hope they can also honor the life that you've lived. I mean, you've done more in your life than most people do, and you're still so young. I mean, you've constantly been busy, clearly, but also I can't imagine doing all that you've done, education-wise and work-wise, where also you've had to carry the transitioning and the outside pressure. I think one of the hardest things that these kids are facing is that they have so many outside loud voices telling them they're not good enough, or they're not right, or it breaks my heart, because I think one of the hardest things in life is being okay with ourselves and looking inside and loving who we are and being good to ourselves. But when these kids have their worth being debated at home, at church, by their friends, in the media, in the legislature, like, it's too much.
I think it's critical. Growing up in Utah, when I can't think of a particular individual that I could identify as a possibility model as a trans girl. But, around 2000 is when folks kind of started to come away from the go stealth model that had been imposed on the trans community by WPATH and various healthcare organizations. You were supposed to transition and go stealth and not acknowledge being trans and whatnot. And it stagnated our progress as far as being seen and having rights and whatnot. And yet there are phenomenal individuals out there that have done phenomenal things. I think of Martine Rothblatt, who is a trans woman and has founded two separate 500 companies, Fortune 500 companies. SiriusXM was founded by her, and United Therapeutics in Silver Spring, Maryland. And she founded United Therapeutics after SiriusXM because her daughter at the time had a condition that had no cure. So she went back and got another PhD, and her company found the cure for her daughter's illness.
Wow.
And it's grown into, in Maryland, this really phenomenal company that is based on finding cures to disease. And I looked at that and how she just kept going, and it was the next thing, right? How do I help others and whatnot, and advance myself at the same time, right? So I look at that, and that's how I've tried to apply things to my own life, is to, okay, yeah, there isn't a model for this, but I've got to survive. And how am I going to survive and also advance things for my community and other marginalized communities?
You know, I'm going to go back to the one thing you said about you're living a life that is creating a model for younger people, right? Or even older people to say, I can do what Stacey's done, and I can have an impact, and I can have a positive life, and I can make change, right? I think that's one of the things that Encircle is trying to do for these kids. Is I think so many of them grow up where, you know, we kind of, I'd say as Utahns, think that life is between these two lanes, right? And these are all the things you're supposed to do. You maybe, for people in my community, you go to BYU, you go on a mission, you come home, you get married, you have a big family, whatever, right? And when a kid is 12, 10, 15, and sees that that is not probably going to work for them, there's this loss of identity and this loss of hope, which we know leads often to suicidality. And that we have got to have role models like you know, and people in the community that show them this is what a queer life looks like. You know, here, you know, right behind you, we have the wall of queer heroes. For these kids to come, and you should see them look at that wall and learn about all the other people who have gone before them. But sometimes we don't talk about it enough. They don't even know the possibilities. So just thank you for being that person for so many people. I just have so much love and respect for you, and thank you for coming back and doing the hard work.
My pleasure. Thank you.